Chapter 66, Shock, Sepsis, and Multiple Organ Dysfunction Syndrome. A 78-kilogram patient with septic shock has a urine output of 30 milliliters per hour for the past 3 hours. The pulse rate is 120 per minute, and the central venous pressure and pulmonary artery wedge pressure are low. Which order by the healthcare provider will the nurse question? Answer is give PRN furosemide Lasix 40 milligrams IV. Furosemide will lower the filling pressures and renal perfusion. Further for the patient with septic shock. Next. A nurse is caring for a patient with shock of unknown etiology whose hemodynamic monitoring indicates blood pressure of 92/54, pulse of 64, and an elevated pulmonary artery wedge pressure. Which collaborative intervention ordered by the healthcare provider should the nurse question? Answer is infuse normal saline at 250 milliliters per hour. The patient's elevated pulmonary artery wedge pressure indicates volume excess. A saline infusion at 250 milliliters per hour will exacerbate the volume excess. Next, a 19-year-old patient with massive trauma and possible spinal cord injury is admitted to the emergency department. Which assessment finding by the nurse will help confirm a diagnosis of neurogenic shock? Answer is apical heart rate of 45 beats per minute. Neurogenic shock is characterized by hypotension and bradycardia. Next, an older patient with cardiogenic shock is cool and clammy, and hemodynamic monitoring indicates a high systemic vascular resistance. Which intervention should the nurse anticipate doing next? Answer is increase the rate of the sodium nitroprusside infusion. Nitroprusside is an arterial vasodilator and will decrease the SVR and afterload, which will improve cardiac output. Changes in D5.9 NS and nitroglycerin infusions will not directly decrease SVR. Increasing the dopamine will tend to increase SVR. Next, after receiving 2 liters of normal saline, the central venous pressure for a patient who has septic shock is 10 milliliters of mercury, but the blood pressure is still 82/40 millimeters of mercury. The nurse will anticipate an order for norepinephrine or Levofen. When fluid resuscitation is unsuccessful, vasopressor drugs are administered to increase the systemic vascular resistance and blood pressure and improve tissue perfusion. Nitroglycerin would decrease the preload and further drop cardiac output and blood pressure. Methylprednisolone or Solumedrol is considered if blood pressure does not respond first to fluids and vasopressors. Nitroprusside is an arterial vasodilator and would further decrease SVR. Next, to evaluate the effectiveness of the pantoprazole or Protonix ordered for a patient with systemic inflammatory response syndrome, which assessment will the nurse perform? Answer is check stools for occult blood. Proton pump inhibitors are given to decrease the risk for stress ulcers in critically ill patients. The other assessments also will be done, but these will not help in determining the effectiveness of the pantoprazole administration. Next, a patient with cardiogenic shock has the following vital signs: BP 102/50, pulse 128, respirations 28. The pulmonary artery wedge pressure is increased and cardiac output is low. The nurse will anticipate an order for which medication? The answer is furosemide Lasix IV. The PAWP indicates that the patient's preload is elevated, and furosemide is indicated to reduce the preload and improve cardiac output. Epinephrine would further increase heart rate and myocardial oxygen demand. 5% human albumin would also increase the PAWP, and hydrocortisone might be considered for septic or anaphylactic shock. Next, the emergency department ED nurse receives report that a patient involved in a motor vehicle crash is being transported to the facility with an estimated arrival in 1 minute. In preparation for the patient's arrival, the nurse will obtain 2 14-gauge IV catheters. A patient with multiple trauma may require fluid resuscitation to prevent or treat hypovolemic shock, so the nurse will anticipate the need for 2 large-bore IV lines to administer normal saline. Lactated ringer solution should be used cautiously and will not be ordered until the patient has been assessed for possible liver abnormalities. Vasopressor infusion is not used as an initial therapy for hypovolemic shock. Patients in shock need to be kept warm, not cool. Which finding is the best indicator that the fluid resuscitation for a patient with hypovolemic shock has been effective? The answer is urine output is 60 milliliters over the last hour. Assessment of end organ perfusion, such as an adequate urine output, is the best indicator that fluid resuscitation has been successful. The hemoglobin level, CVP, and MAP are useful in determining the effects of fluid administration, but they are not as useful as data indicating good organ perfusion. Next, which intervention will the nurse include in the plan of care for a patient who has cardiogenic shock? Answer is monitor breath sounds frequently. Since pulmonary congestion and dyspnea are characteristics of cardiogenic shock, the nurse should assess the breath sounds frequently. The head of the bed is usually elevated to decrease dyspnea in patients with cardiogenic shock. Elevated temperature and flushing or itching of the skin are not typical of cardiogenic shock. Next, norepinephrine or Levophed has been prescribed for a patient who was admitted with dehydration and hypotension. Which patient data indicate that the nurse should consult with the healthcare provider before starting the norepinephrine? Answer is the patient's central venous pressure is 3 milliliters of mercury. Adequate fluid administration is essential before administration of vasopressors to patients with hypovolemic shock. The patient's low central venous pressure indicates a need for more volume replacement. Next, a nurse is assessing a patient who is receiving nitroprusside infusion to treat cardiogenic shock. Which finding indicates that the medication is effective? The answer is warm, pink, and dry skin. Warm, pink, and dry skin indicates that perfusion to tissues is improved. Since nitroprusside is a vasodilator, the blood pressure may be low even if the medication is effective. Absence of a heart murmur and a decrease in troponin level are not indicators of improvement in shock. Next, which assessment information is the most important for the nurse to obtain to evaluate whether treatment of a patient with anaphylactic shock has been effective? Answer is oxygen saturation. Because the airway edema that is associated with anaphylaxis can affect airway and breathing, the oxygen saturation is the most critical assessment. Improvements in the other assessments will also be expected with effective treatment of anaphylactic shock. Next, which data collected by the nurse caring for a patient who has a cardiogenic shock indicate that the patient may be developing multiple organ dysfunction syndrome? Answer is the patient's serum creatinine level is elevated. The elevated serum creatinine level indicates that the patient has renal failure as well as heart failure. The crackles, chest pressure, and cool extremities are all consistent with the patient's diagnosis of cardiogenic shock. A patient with septic shock has a blood pressure of 70/46 millimeters of mercury, pulse of 136, respirations of 32, temperature of 104 degrees Fahrenheit, and a blood glucose level of 246 milligrams per deciliter. Which intervention ordered by the healthcare provider should the nurse implement first? Answer is give normal saline IV at 500 milliliters per hour. Because of the low systemic vascular resistance associated with septic shock, fluid resuscitation is the initial therapy. Next, when the nurse educator is evaluating the skills of a new registered nurse caring for patients experiencing shock, which action by the new RN indicates a need for more education? The answer is maintaining the room temperature at 66 to 68 degrees Fahrenheit for a patient with neurogenic shock. Patients with neurogenic shock may be poikilothermia. The room temperature should be kept warm to avoid hypothermia. Next, the nurse is caring for a patient who has septic shock. Which assessment finding is most important for the nurse to report to the healthcare provider? The answer is skin, cool, and clammy. Because the patients in the early stage of septic shock have warm and dry skin, the patient's cool and clammy skin indicates that the shock is progressing. Next, a patient is admitted to the emergency department for shock of unknown etiology. The first action by the nurse should be to answer, nope, administer oxygen. The initial actions of the nurse are focused on the ABCs, airway, breathing, and circulation, and administration of oxygen should be done first. During the change of shift report, the nurse is told that the patient has been admitted with dehydration and hypotension after having vomiting and diarrhea for 4 days. Which finding is most important for the nurse to report to the healthcare provider? Answer is new onset of confusion. The changes in mental status are indicative that the patient is in the progressive stage of shock and that rapid intervention is needed to prevent further deterioration. Next, a patient who has been involved in a motor vehicle crash arrives in the emergency department with cool, clammy skin, tachycardia, and hypotension. Which intervention ordered by the healthcare provider should the nurse implement first? The answer is provide oxygen at 100% per non-rebreather mask. The first priority in the initial management of shock is maintenance of the airway and ventilation. ECG monitoring, insertion of IV catheters, and obtaining blood for transfusions should also be rapidly accomplished, but only after actions to maximize oxygen delivery have been implemented. Next, the patient with neurogenic shock is receiving a phenylephrine or neosynephrine infusion through a right forearm IV. Which assessment finding obtained by the nurse indicates a need for immediate action? Answer is the patient's IV infusion site is cool and pale. The coldness and pallor at the infusion site suggests extravasation of the phenylephrine. The nurse should discontinue the IV and, if possible, infuse the medication into a central line. An apical pulse of 58 is typical for neurogenic shock but does not indicate an immediate need for nursing intervention. A 28 milliliter urinary output over 1 hour would require the nurse to monitor the output over the next hour, but an immediate change in therapy is not indicated. Warm, dry skin is consistent with early neurogenic shock, but it does not indicate a need for a change in therapy or immediate action. Next, the following interventions are ordered by the healthcare provider for a patient who has respiratory distress and syncope after eating strawberries. Which will the nurse complete first? Answer is give epinephrine or adrenaline. Epinephrine rapidly causes peripheral vasoconstriction, dilates the bronchi, and blocks the effects of histamine and reverses the vasodilation, bronchoconstriction, and histamine release that causes the symptoms of anaphylaxis. Next, which finding about a patient who is receiving vasopressin to treat septic shock is most important for the nurse to communicate to the healthcare provider? The answer is the patient is complaining of chest pain. Because vasopressin is a potent vasoconstrictor, it may decrease coronary artery perfusion. Other information is consistent with the patient's diagnosis and should be reported to the healthcare provider but does not indicate a need for a change in therapy. Next, after change of shift report in the progressive care unit, who should the nurse care for first? The answer is patient with suspected urosepsis who has new orders for urine and blood cultures and antibiotics. Antibiotics should be administered within the first hour for patients who have sepsis or suspected sepsis in order to prevent progression to systemic inflammatory response syndrome and septic shock. Next, a patient with suspected neurogenic shock after a diving accident has arrived in the emergency department. A cervical collar is in place. Which actions should the nurse take? Answer: prepare to administer atropine IV, obtain baseline body temperature, provide high flow oxygen by non-rebreather mask, and prepare for emergent intubation and mechanical ventilation. All of the actions are appropriate except to give large volumes of lactated ringer solution. The patient with neurogenic shock usually has normal blood volume, and it is important not to volume overload the patient. In addition, lactated ringer solution is used cautiously in all shock situations because the failing liver cannot convert lactate to bicarbonate. Next, which preventative action by the nurse will help limit the development of systemic inflammation response syndrome in patients admitted to the hospital? Answer is use aseptic technique when caring for invasive lines or devices, ambulate post-operative patients as soon as possible after surgery, remove indwelling urinary catheters as soon as possible after surgery, and administer prescribed antibiotics within 1 hour for patients with possible sepsis. Because sepsis is the most frequent etiology for SIRS, measures to avoid infections such as removing indwelling urinary catheters as soon as possible, use of aseptic technique, and early ambulation should be included in the plan of care. Adequate nutrition is important in preventing SIRS. Enteral rather than parenteral nutrition is preferred when patients are unable to take oral feedings because enteral nutrition helps maintain the integrity of the intestine, thus decreasing infection risk. Antibiotics should be administered within 1 hour after being prescribed to decrease the risk of sepsis progressing to SIRS. Next, a healthcare provider orders the following interventions for a 67-kilogram patient who has septic shock with a blood pressure of 70 over 42 millimeters of mercury and oxygen saturation of 90 on room air. In which order will the nurse implement the actions? Answer is obtain blood and urine cultures, give vancomycin 1 gram IV,